Chapter 12: The gist of the skin and subcutaneous tissue. I am Fatin Aisha will explain about Chapter 12: Disease of the skin and subcutaneous tissue S0 to L99. A. Pressure ulcer stage codes. First, pressure ulcer stage codes in category L89. Pressure ulcer identify the site and stage of the pressure ulcer. The ICD-10-CM classifies pressure ulcer stages based on severity, which is designated by stages 1 to 4. Deep tissue, pressure injuries, unspecified stage, and unstageable. Assign as many codes from category L89 as needed to identify all the pressure ulcer the patient has. Second, unstageable pressure ulcer. Assignment of the code for unstageable pressure ulcer L89.0 should be based on the clinical documentation. These codes are used for pressure ulcer whose stage cannot be clinically determined. For the example, the ICD-10-CM official guidelines for coding and reporting 2022, page 55 of 150 ulcer is covered by eschar or has been treated with a skin or muscle graft. This code should not be confused with the codes for unspecified stage L89.9. When there is no documentation regarding the stage of the pressure ulcer, assign the appropriate code for unspecified stage L89.9. If during an encounter the stage of an unstageable pressure ulcer is revealed after debridement, assign only the code for the stage revealed following debridement. Third, a documented pressure ulcer stage. Assignment of the pressure ulcer stage code should be guided by clinical documentations of the stage or documentation of the terms found in the alphabetic index. For clinical terms describing the stage that are not found in the alphabetic index, and there is no documentation of the stage that providers should be curate.
The next guideline for pressure ulcer coding is patients admitted with pressure ulcer documented as healed. No code is assigned if the documentation states that the pressure ulcer is completely healed at the time of admission. Second, patient admitted with pressure ulcer evolving into another stage during the admission. Two separate codes should be assigned. First, code for the site and stage of the ulcer on admission. Second, code for the same ulcer site and the highest stage reported during the stay. The next guideline is pressure ulcer documented as healing. The appropriate pressure ulcer stage code should be assigned based on the documentation in the medical record. The last guideline is pressure-induced deep tissue damage. For pressure-induced deep tissue damage or deep tissue pressure injury, assign only the appropriate code for pressure-induced deep tissue damage, which is L89.6.
Hi, I am Nur Shamimi, and I am going to explain about the codes from category L89, the pressure ulcer stage codes. The codes from this category are categorized according to the site and the stage of the pressure ulcer. For the area of the elbow, hip, buttock, ankle, and heel, the fifth character to indicate the laterality is need to be assigned. L89.0 for the unspecified site, L89.1 refers to the right side, and L89.2 refers to the left side. However, the code for pressure ulcers of the back has different fifth character to indicate the laterality as it consists of the upper back and lower back. For category L89.8, there is no laterality code is needed. For the listed code above, the coder must choose the right sixth character to indicate the stage of the pressure ulcer. Next, for category L89.9, pressure ulcers of unspecified site, different sixth character is used to describe the stage of the pressure ulcer. As you can see, the unspecified and unstageable pressure ulcer stage, the sixth character differs from the previous section. Hence, the coder must always refer to the tabular list when assigning the correct code for the pressure ulcer.
Next, there are 4 stages of pressure ulcer, which are pressure pre-ulcer skin changes limited to persistent focal edema, pressure ulcer with abrasion, blister, partial thickness skin loss involving epidermis or dermis, pressure ulcer with full thickness skin loss involving damage or necrosis of subcutaneous tissue, and the last one is pressure ulcer with necrosis of soft tissues through to underlying muscle, tendon or bone. So, the coder should always refer to the tabular list to assign the correct codes that describe the site and stage of pressure ulcers.
Now, let's move to the case. A patient with a stage 3 pressure ulcer on her left buttock and a stage 2 pressure ulcer of her left ankle is scheduled for debridement. Based on the guideline, when there are 2 stages reported, the coder should assign 2 codes. The code of highest stage of pressure ulcer reported during the stay should be assigned first, followed by the second code of lower stage. Hence, the answer for this case is L89.323, which is pressure ulcer of left buttock stage 3, and L89.522, which is pressure ulcer of left ankle stage 2. There are 2 codes assigned for this case. In conclusion, the ICD-10-CM classifies pressure ulcer stages based on severity, which is designated by stages 1 to 4, deep tissue pressure injury, unspecified stage, and unstageable. It is very important for the coder to identify the site and stages of pressure ulcers properly in order for them to assign the correct code.